Hi, everybody. I'm Donna Anderson, author of lovefraud.com and host of the True Love Fraud Stories podcast. Today, I'm speaking with my friend, Mandy Friedman. Mandy is a licensed professional clinical counselor, a certified clinical domestic violence counselor, and a clinically certified trauma professional. I have questions for her specifically about depression. The issue of depression came up in our recent podcast episode called Revenge Against the Lying Cheater. In this story, a 31-year-old woman fell in love with a man and spent 7 years with him. He cheated on her, they tried to move past it, and he cheated again. When she finally realized that her entire relationship was a lie, she slipped into severe situational depression. The woman recovered, but it was a bumpy road, and she came away with tremendous empathy for people who suffer from long-term depression. So, what is depression and what can be done about it? Here's my conversation with Mandy. The man in this story lied, cheated, lacked empathy, and then when confronted was cold and callous. So how does this type of behavior contribute to a person's depression?
Well, it's interesting because one of the things we know about trauma research and research about survivors is that often it's not the traumatic event itself that is the most devastating. It's that there were people that could have helped who didn't, or bystanders who didn't protect, or a family member who didn't protect or step in and do what was right. And so it would make sense that if your person, the person's supposed to be your partner, who is supposed to have your back and care about you, who you've been through 7 years of a relationship with, and now they don't care about your feelings. They don't care about you. They treat you like you're invisible. And I mean, that is probably one of the most devastating feelings that someone can feel, is that their loved one doesn't love them and doesn't care. That would be really, really something that could, kick off a depressive episode that lasts a while, because it's shattering. It really shatters the person, and then they have to go back and question everything that happened in that relationship. And, how could somebody do this to me and not care? And I don't know about you, but in a lot of my sessions, that's something we're discussing quite a bit, is how could this person not care? Often the targets of this behavior are empathic, caring, kind people, and they truly cannot conceive of that frame of mind where you don't care. So when this happens, it's not just that the person's being discarded, it's anything and everything about what they thought about relationships, love, that relationship, past relationships. They're finding out that, this person doesn't care about them. But furthermore, the human race has the capability of treating humans this way. You're not just learning about your situation, you're learning about people. And to know that this is a possibility and that there are individuals walking around out here like this, it is going to shatter somebody. It is quite devastating.
So this particular woman was diagnosed with depression. So what exactly is depression?
Depression is a brain state, and also, a pattern of observable behaviors or states of being. So, and it affects people differently. Some people who are depressed walk around and you can't even tell they're depressed. But then you learn they were actually very depressed. Other people need to be on disability because they cannot function because of their depression. But depression also can be seen in animals when they lose their, partner or their person or their place. If one of the, an animal, a mother, for example, in nature loses their child, they become depressed. So it means a lack of joy, inability to, experience joy or to be motivated to do things that you might normally be motivated to do. You stop caring about yourself, so you might stop taking care of yourself, doing your self-care, and in some cases, people hurt themselves because they're so depressed. But it's a brain state that's neurobiological, it's chemical. And like I say, it can appear differently for different people. It wants to stay. If you picture it kind of curling up in your brain and wanting to stay there. And what it does is it talks you out of the things that would actually help you as a human or make you feel better or might get rid of the depression. So sunshine, getting out of the house, being around people, taking a shower, brushing your teeth, eating, or not eating. Sometimes not eating is what is called for, depending on how people cope. Yeah, it's being very sad and feeling hopeless.
So do you think you covered all the symptoms of depression, or are there a few more that you hadn't mentioned?
Well, yeah, so there might be overeating or undereating. So people with depression might cope with sometimes healthy coping strategies and sometimes unhealthy coping strategies. For example, drinking is a bad idea when we're depressed because alcohol is a depressant. So people that have depression who also drink are going to be very depressed. But some people with depression, they manage their symptoms with medication, or with a combined, with a trifecta of, therapy, medication, and then the strategies that you use for self-care. So the symptoms, depend on the state of the depression itself and whether it's being treated or not. But in full-blown depression, you're going to have suicidal ideation, meaning that you think about what it would be like if you weren't alive. You, again, might start to self-harm, or you might, turn to food in an emotional way, or you might restrict your eating because you just don't have an appetite. You don't really feel like nurturing yourself in any way. You might be sleeping too much. You might be, unmotivated to move. Your body posture changes too. When people are depressed, they will have a more, the gait will be different and the posture will be different with the shoulders. Its head is down a little bit more. The voice will change even. So depression can also look like a lot of other things too. People that are depressed and untreated can be mischaracterized because of their symptoms. So they're sort of anhedonic, don't really care, seems like they don't care. Maybe they're lazy. They're not wanting to be with people, so that makes them snobby or shy or better than. So those behaviors, if people around them don't know what's happening, they are villainized then for symptoms, depending on your interpersonal situation or your familial situation. If you've got depression, but the people around you think it's a choice, then your symptoms could get worse, because then you start thinking that too, that, I can just will my way out of this, or I could just think my way out of this. This is about my character or about my abilities as a human, when really it's just a brain state that is part of the human condition.
So what is situational depression?
Situational depression is when someone becomes depressed, or we could say that someone's brain becomes depressed because of what's happening in their life. You could look around and go, yep, that makes sense. That this person has loss, they have grief, they've got trauma, or they have stress that is, very confining, that their life has become so stressful that they have no freedom of movement. And that can make someone, feel depressed because of their circumstances. So it would be someone that maybe wouldn't normally be depressed, but they become depressed because of what's happening in their life.
So, and how is that then different from clinical depression?
Well, I might call it biological depression. That's what I might call it. That doesn't mean that's the correct clinical term, but if I'm talking to someone in session and using psychoeducational strategies, some people are born with depression because of genetics, because of, brain chemistry and the way their neural pathways have been built in their brain. And it doesn't matter what their life situation is. They could have everything going for them and everything going right, money, fame, access to whatever resources they want, and still want to die or still feel depressed. There are people that need to be on medication for depression no matter what their life state is. So they will be on medication then just, indefinitely, because it's a condition that is innate within them, not that it has to do with their personality or character, who they are, but more so their genetics and the brain that they were given.
Wow. So how is anxiety related to depression?
Well, I love this. I love this because when working with trauma, we, there's the polyvagal theory and the nervous system, how trauma plays out in the nervous system. And if you picture, sometimes it's described as a river or a window, but basically there's a certain amount of stress that someone can tolerate. So we call it a window of tolerance or the river of tolerance, and still be, functioning within normal, with what we would consider to be normal functioning, that we could handle a certain amount of stress and not have it cause us go into a trauma state. And when somebody has PTSD or they've experienced a loss like this, like you've described, after 7 years and then being discarded in this way, that's going to take that person out of that tolerance.
Mm-hmm.
You're no longer in that river or window of tolerance. And some people, and if you could see me right now, I'm pointing up, become hyper aroused. So they go into trauma states that are of hyper arousal. And that's anxious. That's, busy, anger, can't eat, restless, can't sleep. And then we have hypoarousal, and that's the depressive, don't want to move, sleeping too much, down. And then there are people that kind of ping pong between the two and will be sometimes in that hyperarousal state, and then other times they'll be in the hypoarousal state. So that's the movement from a depressive mood scenario versus an anxious mood scenario, and how someone might even have both of those things going on when their life becomes so stressful or circumstances become so traumatic that their internal trauma systems kind of kick on, and the body is trying to do something with this information. And the hyperarousal or hypoarousal is the way that the body's trying to deal with it. But unfortunately, we're not really meant to live in those states as humans.
Mm-hmm.
And animals, are not meant to live in a trauma state for very long. But when your life is chronically that way, that you've had loss, that you have stress. I think about people that have had traumatic histories, but then say they're caregivers for their aging mother or, and they're poor. There's so much going on. And after a while, your body just can't handle that kind of stress anymore. And so inevitably, you're going to have some kind of bodily response, visceral response, medical response to such extreme stress.
Wow. So are there factors that may increase or decrease a person's chances of developing depression?
Absolutely. We have genetics, of course. Something that I just learned recently in my most recent trauma certification is that if you were raised by a father with untreated PTSD, you are more likely to develop depression. If you were raised by a mother with untreated PTSD, you're more likely to develop anxiety and PTSD.
Wow.
So there are definite things that can make people predisposed. If you don't have a healthy support system, if you're not getting good sleep, if your nutrition, your options for nutrition is limited, medical conditions that cause people to feel depressed can be factors.
So, is depression common among your clients who are involved in abusive relationships?
Absolutely. It's very common for people that have been abused, whether it's present day, fresh, or it was, in childhood 20 years ago. If you've experienced abuse from caregivers or intimate partners, and you have been targeted by people that are manipulative, that they have exploited you, mischaracterized you, purposely misunderstood you, and then furthermore making fun of or mocking your pain, laughing when you are hurting. It's naturally going to create within a person a state that you're trying to figure things out or cope. And notice how that some people who have been abused turn out a certain way, and other people who have been abused turn out a different way. I mean, don't we hear that all the time? Hurt people hurt people. Well, some will develop, deep-seated depression and carry that throughout their lives. Or it could be someone who's never been depressed before, but they've also never experienced abuse before. And it's their first time being abused in this way. So for those that had experiences in childhood, they might be, it's been normalized, that the poor treatment is normalized. And so we continue to make these same relationship choices, surrounding ourselves with people that mistreat us because it's what we know. And then we wonder why we're depressed. Well, everybody around you is a jerk. And they're not supporting you at all. And when you try to do things to better yourself, they mock you, make fun of you. You're not really allowed to be happy. You have to act happy with the way things are, the status quo, and just act happy. Then you have those that they had a great childhood, nothing ever went wrong, and they meet somebody, and the next thing you know, they're getting a major education, and that's fresh information for them. So they're not depressed because of their past and having been abused their whole life, but they're just depressed because they just found something out about people that's devastating. I heard something the other day, and it was about healing, and that healing from trauma, and this is someone's quote, so if I'm quoting someone else, I apologize. I just read this on like a meme somewhere, and it said that that healing from trauma isn't about the traumatic incidents and healing from the incident. It's learning to feel joy. And I thought that was so interesting a way to put it. It's kind of true that at a certain stage of our treatment and our healing, we have processed the past, and we've faced the tough stuff, and then we still don't feel happy. And good things happen and we don't believe it. We wait for that other shoe. We can't really allow ourselves to feel happy, relaxed, and safe even. So learning how to feel joy, learning how to feel safe, learning how to relax in your own skin, those are all things that people will go through as they're healing from trauma.
So, how do you help clients who are depressed because of psychological or emotional abuse?
When I'm treating clients who are survivors who are experiencing depression, I start with psychoeducation. One of the things depression causes us to do, and trauma and abuse, is to carry a lot of shame. And shame often comes from many misunderstandings and faulty beliefs about self. So when we learn about the neurobiology of depression and how the depression is outside of who you are as a person, I love to use our GI system because it's funny and irreverent. But with depression, you have the stream of consciousness that's out to get you. Your inner dialogue or monologue is saying really mean, horrible things to you, and you believe them. But your thought patterns when you're depressed are no more meaningful than farts. Your GI system, if you were to eat a taco and you're getting a little gassy, you don't go, "Oh, I'm a horrible person. I don't deserve love. I don't deserve to be here." You just go, "Oh, that's a little embarrassing. I feel a little gassy because I ate a taco." With depression and anxiety and PTSD, these are all chemically based things that happen in your body, in your brain. Your brain is just an organ like your stomach or your heart. And we forget that because in Western culture, we're taught I am my thoughts. My stream of consciousness is me. So when my brain says you suck, I believe it. If my brain says you should worry about the future because everything's going to go terribly wrong, I believe it. But when we teach people about depression and teach them about mindfulness and how to step out of that stream of consciousness and recognize it as being depressive thinking, and that I don't need to pay as much attention to those thoughts or assign so much meaning to those thoughts because I know I'm depressed right now. And these are depressive thoughts that I'm having, and I don't need to listen to them as much. But that concept of mindfulness is something that not everyone can access depending on where they are in their trauma state. After a while, you get kind of hijacked by your chemistry, and you're not able to access the mindfulness of stepping out of your own thoughts. But mindfulness is a really good strategy to help clients. And then we have to also do physical things. We have to get up. We have to go get into the sun. We really do need to walk. Some people really love animals. They'll have emotional support through their pets. And I encourage that. So, getting into nature and looking at the trees with the leaves dancing. I'm looking at it right now at my window. It's a lovely day and the sun's shining through, and I can just see these little glistening, shimmering lights coming through the leaves. And that just reminds me that life is beautiful. Even if I don't feel it right now, I can see it and I can still appreciate it. So whatever strategies work for each individual client is what we should be doing, is, making sure that whatever approaches are being used match with the client and what works best for them.
Okay, so what are your views on medication for depression and anxiety?
Well, so medication is something that people can take temporarily to help kind of, get you through a hard time, or it's something that some people need to take all the time and forever. I like to describe it like this. When I'm working with someone who needs medication, or I feel they might need medication, and by the way, I am not a medical doctor and I don't prescribe medicine. This is just my observation of clients and how I've seen them respond to medication. And also, I don't have a problem stating that I'm also on medication myself. And I have my own personal stories about medication. But if I'm working with somebody that needs medication, it feels like this. I feel like I'm on one side of the fence and you're on the other side of the fence. And I'm saying to you, I promise it is so nice over here. I promise you it is just beautiful. I promise there are nice people here. The grass is lovely. It's the air is nice. It's just so nice over here. And you're like, yeah, I hear you, but I'm just not able to really believe that's true. I like the sound of it. I've heard people talk about it, but that's just not for me. And I'm sure that's not how it would work out for me. I just really can't see what you're talking about. So that's what those conversations feel like. When somebody takes a medication, to me, it gives them like a step stool so that they can just peek up over the fence. And that's the effect it will have in therapy, is just expanding the possibilities that you can perceive of, and also having maybe a little bit more hope about your abilities to overcome your circumstances or overcome your symptoms. But when someone is, so depressed or in that brain state to such a degree, they can't even picture something that is nice. They can't picture something nice happening to them. So they're thinking, yeah, lady, that's your job to tell me that stuff. You're just being nice to me. I'm paying you. So you're just saying that. But, that's not for me. But once they get medication, they're like, oh, I see what you're talking about now. I really could possibly have healthy relationships, maybe. I'm like, yeah, you probably will be able to. So medicine can make a really big difference. The problem is the stigma. Well, there's two problems. There's stigma about it. So you want to be careful about who you talk to about it in your support system and inner circle. You certainly don't want to tell anyone that is manipulative or abusive that you are medicated, because they always weaponize that information. And the other problem is that there's such a trial and error that people have to go through to figure out which medications work for them. So they'll often give up after 2 days of having, an uncomfortable side effect. And then you have side effects that aren't good, and that we do need to stop the medication, but not because you're feeling gassy or because you have a little headache. It's not working. So people ditch out. But now there is a test. It's called gene site testing. If you can afford it, I don't think insurance pays for it, which is just, don't get me started on that. But what that does is it's a genetic test. It's about $275, I think. It was actually developed in Cincinnati, where I am. And your primary care physician should be able to order it for you. And then what that does is it tells you which types of medications work with your body, and that eliminates the trial and error difficulties. The trial and error, if it takes 2 weeks to 2 months to really see how medication is working, and then you give it a go for a few months, let's try this. Next thing you know, a year's gone by. And that's so frustrating when you're trying to get better and feel better, to have to deal with that. And then to find providers that can do the medication management if your primary care physician doesn't want to do it. So it can be a hassle. And that's another thing that deters people besides the stigma. But I believe that it is 100% worth it to give it a shot and see if something might be helpful. And there's all kinds of different treatment strategies too that people are using today. So you can also think outside the box, and there are more holistic approaches that can be used as well. So if something that you're trying isn't working, or you don't like the idea of medication, okay, fine. I would encourage you to expand your thinking about that a little bit. But if it's a firm no-go, okay, but we got to find something. We got to do something. So let's think outside the box and do some more research to find perhaps something else that could give you just the little step stool that you need.
So how long does it take to overcome situational depression? Something, a person was basically healthy until something happened. How long does it take to get over that?
It really depends on the person and their situation. I've had people that, they maybe did not have an abusive childhood, and, they'll be depressed for a year or so, maybe after the relationship is over, or whatever horrible experience they had. And then I've had other people that it lasts longer than that. Might last a couple of years, or somebody that they struggle with it comes and goes. They'll be feeling better, and then, maybe something will go wrong in their personal life, and then it'll come back on for a little bit. So if they have a good support system, if they're living a healthy life and they have access to resources, they're more likely to recover more quickly. If their life is stressful, they don't have access to resources, or they are caregivers of children or of other people, just the stress of life alone, if you're up all night with kids, if you don't sleep well, if your husband snores or your partner snores, whatever it is that keeps you from being able to access that neuroplasticity that we need to heal. When we're healing from trauma and depression, and we're working on anxiety, we really are building new neural pathways. But we can't access that neuroplasticity to create the neural pathways when certain things are getting in the way. So when you feel like you're stuck, or you feel like it's taking a long time, it's really a bad idea to get out the measuring stick and start thinking, I should be farther along. I shouldn't still be feeling this way. There's something wrong with me. Now here you go again, saying there's something wrong with me. I should be better. That's shame. That's you saying that you have a choice here and you could just will it to be better if you just could, be stronger, or whatever you're telling yourself. And it's not that. It's chemistry. It's not a matter of will. Something that is a matter of will is that once you do find what works for you, you can protect that as best you can. That is up to you. Is that when you are trying to get healthy, you want to protect your progress. And that's by making good, healthy choices that support the life you're trying to create. So that part is on you. And part of that is a choice. And sometimes it's not. Sometimes things just happen and you have to deal with it. And it was outside of your control. But when you start making it about that you're a bad person, or that you're not moving along fast enough, that's a depressive thought pattern. Mm-hmm. It is inherently depressive because it's blaming you for something that is really, truly not your fault.
So the woman in this story emerged from the experience stronger and more empathetic. So do you have advice that would help others to grow from an experience like this?
Absolutely. This is something that I see people comment about on social media is, the concept of resilience. And we know that, and this is with research, that those that have a higher resilience abilities, in their personality and in their brain, that they will be the types that come out of a situation like this, forged in fire and stronger, more adaptable, and then furthermore, helping others, capable of helping others. And then we have other people that don't necessarily share that same resilience factor, and they're affected by their circumstances differently than the ones that might be a little bit more resilient. If you're going to try to make meaning of what happened, if you're going to try to look at the time that we say was wasted, those moments of scraping yourself up off the floor one more time, that has to have value. It has to. And if you choose not to see the value in it, that's okay. And I respect it, but it's really not the healthiest perspective necessarily to see it as something that, there's nothing to be done about it. It just happened. And now here, look what I have. I have to deal with all this mess, and I shouldn't have to. You're right. You shouldn't have to. And you're right. You have to take responsibility for creating the life that you need to create now as a result of what you went through. And when people are the type that see the little moments of growth and are inspired by that, they light up. I can see it happening, and it fuels me too. It makes me feel like, okay, they're picking up all the little Easter eggs and they're gobbling them up, and then they get stronger, and then their perception changes, and they make different choices, and then they have better boundaries, and now they have more energy because they're taking care of themselves, and it starts to accumulate. And that is something that's really rewarding to watch. And sometimes it's even despite their own efforts of saying that, I'm not going to gain anything from this. Like, well, you might not think so, but now you are talking about other situations in your life that need to be corrected, that you would not have done if you hadn't learned this lesson. If you hadn't learned about manipulative people, your daughter might still be married to that guy. Your best friend might still be, messing with something they shouldn't be. You wouldn't have made the future healthy choices that have gotten you into the life you have right now. So there's a lot that we learn from what we went through, but that's a matter of what meaning the person wants to make out of their experiences.
I'm Donna Anderson, and this is True Love Fraud Stories. I hope you enjoyed this interview with Mandy Friedman. To learn more about Mandy's work, please visit her website at clermontmentalhealth.care. For contact information, please visit the page about this interview on podcasts.lovefraud.com. True Love Fraud Stories is produced by lovefraud.com. I'm the author of lovefraud.com. Engineering is by Terry Kelly. To learn how to recognize and recover from everyday sociopaths, visit lovefraud.com. And for more information about this story, other great stories, or if you'd like to share your story, visit podcasts.lovefraud.com.